As a patient in Ontario, for example, you're issued an OHIP card, and I believe that stands for Ontario Health Insurance Plan. And you literally walk up to the counter at the doctor, and in the States they ask you for your copay. But in Ontario, for example, you walk up to the counter and you hand the card that looks like a driver's license. They swipe it, and you go sit down, and you wait for the doctor to see you, and you never are issued a bill or anything. Basically, it's nice when you can go to the doctor's office and not worry about having to write a check for $30 just because they looked in your mouth because you had a sore throat. You feel sick, you go to the doctor, you don't have to worry about paying out of pocket. There are a lot of elderly couples that go to Florida for 6 months during the winter time, and then they come back for the summertime to Toronto, and they'll keep their health care card, and because healthcare is really expensive, so it's free in Canada. So what they do is they lie to the government. They don't even say that they're away for 6 months of the year. The government they don't have a way of checking it. They don't check. It's only when you go and you volunteer the information that you get your health card taken away. Well, I'm pretty sure that taxes are higher to compensate for the health care. I know that there's a finite amount of money, and eventually they're going to run out of money to pay for health care, and they'll have to raise taxes again. And when I moved here and I started getting bills from the doctor, that was crazy to me. I thought, okay, well, I've already paid you my $30 copay, and then, whatever I pay my insurance, $300 a month or something like that. And then on top of that, I get an itemized bill. And I'm saying, I didn't know that this cost this much, and wow, a pap smear is $80? Things like that. It's ridiculous. It's really expensive to be alive in this country. I mean, you could just not have health insurance and hope for the best. But it's like car insurance. You can hope for the best, but if something happens, you go to the hospital for the night, there's $10,000.